My name is Dimitri Martinovich, and I'm a student at George Brown College studying to be a community worker. And I was invited here by Herb Tukey, who I think he invited me to come and see a case in point where people from one organization had come into some kind of conflict with each other, and there was going to be some kind of action happening today. So that's what I'm here for.
Okay. Well, I'm with the Recession Relief Coalition, and we're just setting up an outreach program ourselves. And we have a graduate of the I believe the course you're taking, and also another person that's in that program right now as volunteers in that outreach thing. Would you be interested in doing a little outreach work as a volunteer?
I'm pretty busy at school.
I know
it's very intense at school. We have a lot to cover, so in terms of volunteering, I don't know that I could do that.
Okay, well, you know what? Check out our website. It's www.recession-relief-coalition.org and see what we're doing.
Okay.
Thank you very much.
Okay.
My name is Michelle. When I came here, it was pretty fucked up, and still am, but what I'm trying to say is, hey? Yeah, okay. What I'm saying is, like, if it wouldn't be that guy, I don't think I'd be around, and I'm not the only one. There's many people who wouldn't be around no more, right? And sending him somewhere else, I know he's not a caseworker and all that, but I don't see, like, for me, seeing him once a while, once a week, whatever, I like it because it's positive in my life, right? And sending him somewhere else and telling me to go see him in the Victoria thing, I'll never go there. So for me, it'd be a big loss. Like I don't know why. If they're running out of space or something, but they don't give no reason why, right? They're telling me that you still have the same schedule and all that, but he just ain't gonna be here. It just don't make sense. I think he's been here for what, 30 years or so? I mean, come on, you know? Thank you.
Hey folks, so my name is Hamid Osman, and I'm from the Canadian Federation of Students Ontario. The Canadian Federation of Students Ontario is a student organization that represents college students and university students. And the reason why we're here today is because we as university and college students recognize that the fight of the homeless, the fight of the impoverished, and the fight of students are not in silos. Our fights are united. For an organization like Street Health to exist just shows how people are being pushed into poverty by the lack of investment from our federal government, our provincial government, and our municipal government. But at the same time, by the hard work and commitment of people like Gaetan for the past 30 years, just shows our strength and our fight back to have this investment continue. So that's why we have students here from Ryerson, students here from York University, and folks here from our office to tell you that we are with you in this fight, and we'll continue fighting to have Gaetan here to serve the members of the community here. Thank you so much.
But what happens when agencies stop being willing to speak out? And, you know, agencies got their budgets cut across the board, and they kowtowed to the government in the 90s and the 80s, and it didn't stop them getting their budgets cut when they kowtowed to the government. Kissing the government's ass isn't going to save your budget. Speaking out, forming coalitions, fighting for services for underserved communities, for oppressed communities, is what gets funding. Kissing ass has never gotten anybody anything in this society.
Okay, I will never disrespect Street Health for all the help that they've given people. But for this part of the Gaetan, I'm going side to side on this one. But I just have one question for Street Health. Why did you buy that building across the road to build new offices and everything, and you never moved into the bloody building to start with? And now you got it up for sale, and you're still living in the dungeon. I rest my case.
Hi, what I'd like to comment on is with Street Health, government moving offices has never been good for anybody's health. They started this back in the 80s with filling hospitals full of offices. now they want to have them designate that they can what, improve our health? I think not. I'm actually a worker myself with Kingston General Hospital, CODA worker, and in my volunteers work years ago, I helped in giving these kind of concepts. It's never been office workers ever could help anybody with their health. It's doctors, nurses, workers, etc.
Hi, my name is Danny Antonioni. I know Gaetan for years. Right now, he was a nice guy. So anyways, I don't know why he's getting kicked out of street help for no reason. Moving to Scarborough is not going to do me any good. It's to stay and come back to fight, stay there to help the homeless people without the streets. But anyways, Gaetan needs to stay on street health. But Laura says, you don't have to believe her. Laura's trying to put a sticky attitude, boy. This is not right. Hey Laura, if you're in there, you better come on and listen to this. If you're there. Well anyways, I hope Gaetan gets back to the street health, get his job back. Doesn't matter if he's an employee or not. So anyways, I wish him all the best. And Gaetan, please come out. And we want to wish you back into the office. So anyways, I wish you all the best, Gaetan, to get your job back. Yeah, so you take care, eh? Gaetan, I hope I see you out. So anyways, let's fight for Gaetan to get his job back. We don't need this shit anymore. Fuck the government and fuck the rest of the world. So we need Gaetan back into the office and to do his job back. Right now it's not going nowhere. In the meantime, we need Gaetan back to the office, doing his job, print out ID forms for the homeless. So anyways, I hope you hear me, Gaetan. This is for you. I wish you all the best. So Gaetan, stay in the office. You're not going to Scarborough. Thank you.
Woo! I just also want to say I also am here to represent No One Is Illegal, and that we get services through Gaetan for non-status poor people all the time. And people without status can't access any services without ID. And time again, Gaetan has worked his magic, got an ID for people without status, and they've been able to get the services they need. So I want to say to Street Health, you're also impacting on many, many more communities with this move than you can even imagine. And that all you're doing is asking those communities to come out here and show their anger again and again and again until you remake this decision.